Well, first of all, let me say thank you so much for being a part of the session today. As we say, my name is Javon McClain. I do have a doctoral degree in pastoral theology. I'm a little country boy from Rayford, so I don't mind being called Javon. It's okay with me. But if you want to use doctor too, that's fine. My church people call me Dr. J. So whatever you like is fine with me. Just to introduce a little bit about me is that I am a gay married black man, and I'm not only just a black man, but I'm also a pastor. So today I'm actually representing Southern Regional AHAG and the work that we do through our Wake Forest Divinity Campus grant that they've given us, and we are part of the Faith in Action grant. And so what that looks like for us, right? I represent several different types of communities, right? So number one, I'm an advocate, so I'm also a person living with HIV, okay? And I don't mind you knowing that. But not only am I an advocate, I work in case management as well, okay? And so what happens is in my life, all those things kind of get tied into one conglomerate, right? Because I'm a pastor of an affirming church. I also am an advocate, and then I work in the field. And so I sit on some other stuff too, right? So right now, currently, what we do through the Faith in Action grant, okay? If I can speak specifically to that. We, number one, the first year we were actually funded. This is our second year being funded. That's always wonderful, right? This is our second year being funded, and so in our first year being funded, what we did was we, of course, put up some not bulletin boards. What's the big thing called? I can't even think of the word. The billboard. Thank you. Help me out today. Praise the Lord. Billboards, and so those billboards spoke to the fact that we need faith leaders involved in helping to break the stigmas of HIV. And so we have like 2 of those up in the city where we live in. I'm in Fayetteville, North Carolina is where I work out of, okay? And then outside of that, we started the radio broadcast. And so when I radio broadcast, I'm on WIDU 1600 in Fayetteville, North Carolina. And so they have a couple other places. They hit Lumberton, Red Springs, Rayford, Laurinburg, and Fayetteville as well, okay? And so with that, we're actually able to do a session. We started out with once a month, and so now we've grown that to twice a month. And the wonderful thing that I love that we've been able to do with that is because Dr. Matthews did a great job of explaining to us this morning how HIV and AIDS has disproportionately affected Black and people of color, amen? And so with that being said, we're able to literally hit the community because WIDU is primarily a Black station, a Black gospel radio station. And so we're reaching well over 200 churches. And then 200 churches, and I think they have over about, if I'm not mistaken, the last time they told me it was like 2,000 or 5,000, somewhere between 2,000 and 5,000 listeners, okay? And so with that being said, we're able to not just on the first Thursday of the month, I talk about faith and HIV specifically, right? Last Thursday of the month, every month, I'm able to hit other comorbidities that are also disproportionately affecting Black and African American people. So I'm able to talk about diabetes, I'm able to talk about heart disease, I'm able to talk about kidney disease and high blood pressure, which are also probably like 4 things that are really, really predominantly hitting HIV. If I could say anything today to us as people who are in ministry or either in healthcare or engaging your churches in the work, what I would take from this is, and I've really not heard anybody say it a lot, so I'm going to use it today. I believe that when people give a thing, you need to stick with their thing. So what would help us a lot is that if we really would become mindful together. The way in which we do this work, the way in which we break stigmas is that we come together and we be mindful together. That means that I need my healthcare partners to partner with us. That means I need Wake Forest Divinity School. I need schools like that. I need the North Carolina Council of Churches in order to be able to do the work that God is really calling us to do in our community. And outside of that, I think of the fact that it's going to take those collaborations. And so you're going to need those. And if I can say anything else, especially for anybody who's watching this later, the camera right there.
The camera's there and the mic is right there.
I need to get like right in front of it though, because I got a big mouth. If you have not partnered with the North Carolina Council of Churches or Wake Forest Divinity School, their Conference Coordinating Center, baby, you are missing out. Listen, collaborations and the partnerships are what's going to get us to do the work sincerely that we need to do. And I'm learning that so much more. And so currently, just because of the few things that we've been doing with this faith and HIV work, I've been able to partner with our health department in our area where I have direct access to the public health director. I can call her cell phone myself. You get what I'm saying? So we need to build these partnerships. I got what, 3 minutes? How many minutes I got? Oh, good stuff. I got 5 more minutes to hit it in. Okay, so and then on the outside of that, we've built partnerships not only with our health department, but we've been able to build partnerships and collaborations with organizations such as Delta Sigma Theta, Sigma Gamma Rho. I've done several platforms for those ladies. And we've also been able to do things like sit on a fellow states university's campus. Actually, I just did a meeting with them about collaborating with them in 2023. So just being able to build those partnerships. And if I could really, really hone us into anything, is I would say to you that if you are a leader or if this is an area of passion for you, when you speak about HIV work and faith and breaking these stigmas, all I'm telling you is that when it comes down to it, understand what you need to bring together in your life. That way you're not running all over the place. Y'all, if I literally like try to separate everything that I do, I would be here, there, and everywhere. But because of who I am and because of my life, I'm able to say, you know what? This is who I am and this is the work I do. And so not only does it get incorporated into my everyday job, it also gets incorporated into my everyday pastoring. It gets incorporated when I'm just out in the community, just speaking to people and talking with people on a daily general basis. And so what I'm telling you is that if you don't understand anything else from what I said in the vein of HIV and faith, if I cannot leave one word with you, the one word that I would leave with you would be collaboration. If you don't learn to collaborate, you're always going to be looking for money. You're going to always be looking for a way to partner with somebody else to do this work. But when you collaborate and you begin to do the work, people will see that you're not just out here by yourself, but you have other partners that are invested in the work. And they'll be ready to give you some money. Trust me when I tell you they will. And so if I can leave anything with you, collaborate. Collaboration is the biggest thing that is going to sell what you're doing, what you're getting, what you're making come to pass in your community and in your churches or your health partnerships, whatever it may be, okay? I'm going to take my time and sit down, and I'm going to let them have the rest of it. Y'all have a good one.
Well, hi there. Good afternoon. Hope everybody had a nice lunch break and maybe played some cornhole or anybody do yoga? Awesome. I'm Suzanne Watts Henderson, and I am so delighted to be with you all today. It's been a rich day of learning and conversation and networking toward the collaboration aim. I'll say a little bit about who I am and why I'm here today, and particularly as it relates to this exciting work to destigmatize HIV and AIDS. So I live in Charlotte, and I've been on faculty at Queen's University and dean of the chapel there for the last 15 or so years. And as I've been doing that campus work, I've increasingly worked closely with an organization based in Chicago called Interfaith America. Interfaith America's goal, it's a nonprofit and sort of thought leader in engaging religion as a positive for the civic good. So our mission is to inspire and equip and connect individuals and institutions to unlock the potential of religion, right? And of our nation's religious diversity. And so we have been active on higher ed campuses for the last 10 years and more recently are expanding beyond that. We're expanding into the space at the intersection of faith and health, in part because we did a lot of work during the pandemic in vaccine outreach, partnering student ambassadors with faith-based organizations to get folks good information and access to the vaccine. So bridging the gaps in education and access that were endemic to the communities that needed the vaccine most, right? And we saw just such joy and life come out of those kinds of collaborations. And in the midst of all this, we had the opportunity to partner with Wake Forest Divinity School's Faith Coordinating Center to work to destigmatize HIV and AIDS. And so we were fortunate to be a grantee in that program last year and again this upcoming year. So my goal today is I just want to say very briefly, just give you a little map of what we're doing nationally and then focus in on this particular work. So we have this growing portfolio of faith and health activities. I'm on leave this year from Queens to kind of oversee the body of work at the kind of 30,000 foot level and make sure that it coordinates and collaborates, as I keep looking at Dr. J, and collaborates as best we can. So at the national level, we have produced some case studies for campus curricula. We've issued Faith and Health campus grants that are working both in the classroom and beyond to explore the intersection of faith and health. We have emerging leaders who have an ability to navigate religious identity across difference in civic spaces and in healthcare. And we have a growing partnership with an organization in New York called Chautauqua, where we'll convene leaders from across the country next summer to address the connections between faith and health. We have a focused presence in the Chicago and Illinois areas where our nonprofit is based. I've been leading, as I said, vaccine outreach work in the Carolinas, and then the Southeast is where we're doing the Gilead Compass Project work. So we've been working with campuses throughout the South over the last year. And I want to focus on 2 North Carolina campuses just to give you a little bit of a flavor for the kinds, really diverse kinds of activities that they have been offering and the real difference that they have been making. So Livingstone College down the road in Salisbury, affiliated with the AME Zion tradition. We have a fantastic educator there named Detarvia Parrish. She's been actually working with me in vaccine outreach as well. And she has such a knack for tapping into the energy and the creativity of her students and really strengthening their role as ambassadors. So in the work to destigmatize HIV and AIDS, the Livingstone College team has been working on at least 3 levels. So they've been working on campus, that is within the campus community, doing surveys about status, normalizing, the testing, and just as a part of the suite of tests that you do, right? So that folks just sort of think of HIV and AIDS along the lines of any other thing that we want to watch out for. So lots of on-campus work made really effective because of the student ambassadors. Then reaching into the community and having the kind of community partnerships that Dr. J was talking about. And then nationally, because it is a leading AME Zion campus and with ties to some of their national syndicated programs, using those channels to reach really national audiences through their scope of influence there. Also, North Carolina Central, such a phenomenal partner that we've invited them to come along for another year of granting activities. We actually had 2 teams within their campus working both on campus and off campus to destigmatize HIV and AIDS and to get just great information and access to treatment and other kinds of management. And so I want to show you a little clip. I'm going to give most of my time to the voices from the NCCU campus. Elizabeth, let's take a look.
The Office of Spiritual Development and Dialogue family. But most importantly, I am proud to be a part of God's family. Each of us belong. We all belong.
Hello, my name is Sydney Wilkins. I am a first-time interfaith ambassador working with the Spiritual Development and Dialogue Office. We have had a chance to work for the Faith in HIV/AIDS Capacity Building Grant. The project we are associated with is called This Far by Faith, which provides needed resources for educating and connecting with individuals on a spiritual level. The project creates a safe space for those to comfortably learn and spread the word through reliable sources. Our team partners consist of Reverend Pastor Gloria Winston Harris, Director of NCCU's Office of Spiritual Development and Dialogue, Dr. Roderick Health, Director of African American Male Initiative, MAC, and Miss Annette Carrington, who is the Adjunct Director with Public Health Education. These individuals have all taken the time to spread the word on AIDS and provide spiritual guidance for individuals eager to learn. Events that have taken place include the dinner table for women only, the dinner table for men only, and testimonial videos passing out information on HIV. I am so grateful to be a part of an association with a cause to better inform those who are interested in being educated on AIDS.
I believe from a faith standpoint that it's important to know our bodies. Even though there's a stigma around HIV, it's important to understand what HIV is. And it's important to find help for ones that maybe are suffering from silence or they may not know too much about HIV.
We're also going to have a little later talk about HIV and other things that go on. So we have some speakers tonight. You guys are young adults, next generation. So tonight, let's love on each other. Let's eat good, and welcome you out to the HBCU Love Story.
With me, for my partnership, we had a panel discussion regarding the vaccine where all the brothers came and all the girls came, and we just, a lot of questions were asked about HIV, how we can prevent it and the things that we do to prevent this. And it's not just for one particular group, which is what everybody, says is going around, but it's really not. It's for everyone, So please just know your status and make sure your partner knows your status.
Has a different face now. HIV used to be called the gay man disease. It is still killing now African American men, but those are the men who have sex with men, and they're the young black men. When you look at those young black men, and we are afraid to ask a man what's his body count, because we're gonna think that means we trying to be too easy, then the women are ending up putting themselves at risk. Those four behaviors.
As an interfaith ambassador, I had the pleasure of working with HIV awareness program. And in that program, I was able to speak amongst a group of women and express how our faith plays an important role in our physical. But most of the time, it's not just a physical thing, but it's also emotional. I was able to speak with women from all different faith traditions and talk about the importance of our body and keeping ourselves together physically, emotionally, and spiritually. I truly enjoyed the program.
During my time as an HIV interfaith ambassador, I learned many things, but I learned more about the hidden, meaning that HIV and AIDS is something that isn't much spoken about in my religion. And being an ambassador, I learned that it's okay. It's okay to express the topic of HIV and AIDS, learn what causes it, how it could be prevented if caught early, and how to protect yourself, and just much more. What I really liked about the program is that I was surrounded by wonderful intellectual people who love to discuss their culture on HIV and AIDS and learn more about others. This experience impacted me highly. I feel as though through the lens of faith there is so much change that could happen and be taught to different people of different religions and cultures, especially when people of different faiths are brought together to heal together. I want to thank you so much for listening, and a huge thank you to the people who made this all happen. Pastor Gloria Winston-Harris, thank you so much. I also want to give a huge thank you to the Interfaith Youth Corps and Bridge Builders. Thank you, guys.
Just a little glimpse of the life that you can see in student testimonies there. So we've had a really exciting year, and we've learned just a few things. I'm going to be echoing some of what Dr. J said. What we've decided our students are just the best. They are the best ambassadors among their peers, but they're also fantastic about going out into the community and coming alongside folks who are doing really important destigmatization work and access and education work. And they just are like sponges soaking up the opportunity to be in the community and helping. This point is pretty obvious, but to destigmatize is to normalize. So wrapping this topic, not sort of setting it off by itself, is particularly on campus, in campus context, but wrapping it into a broader conversation around health-related issues, just normalizing it, and just particularly on testing and status and that kind of stuff. Partnerships are key. That's the collaboration point. And then faith matters. Of course, you're here at this gathering because you think faith matters. It doesn't always, it's not always obvious to everybody in the broad public, but our faith communities, our faith identities offer such inspiration and such social capital to connect us, to collaborate, because of the deep wells of nourishment and inspiration that we can draw on. And students really respond to that, regardless of their faith tradition, and even if they don't claim one. They get that these questions about deeper values, and we've heard a lot today, loving on people because they're people, right? We are beloved children of God, as Pastor Gloria says. Students really appreciate engaging at that level. So I think sometimes folks think of the younger generation as maybe too secular or not engaged. They're just waiting for the invitation. So I would encourage y'all to continue on that front. So we're now in the process of recruiting for another year of these capacity building grants for campuses that are HBCUs or historically minority serving institutions. We have this wonderful partnership with Wake Divinity's Faith Coordinating Center. Both campus and community learning is what this is about, and the networking opportunities. We hope that just because the campus receives a grant for this year doesn't mean that that's the end of the partnership. We hope that this opportunity catalyzes longer term partnerships between higher ed institutions, which are these wonderful sources of youthful creativity and vigor. Yes, the students will graduate and move on, but other students will come along. So I think that the joy of the campus community partnership is something that is at the heart of this project and really magical. We have, in addition to providing some funding for each campus, we provide interfaith training sessions to the whole network. We have virtual gatherings for the whole network to connect on their social media messaging and other things. And of course, Wake Forest offers lots of great online training and networking opportunities as well. This year, we're going to have a series of Instagram live conversations, interfaith conversations by 3 men who identify with very different faith traditions and have dialogues around destigmatizing HIV and AIDS. We're going to be accepting applications until October 14th. So part of this is a little bit of a plea. If you know of someone at a HBCU campus, either in North Carolina or throughout the Southeast, we define Southeast as pretty much what everybody else would define, except for not Virginia, for whatever reason, right? And so if you have folks that you think might be interested in learning more about this opportunity, we would love to get on a call with them. My wonderful partner, Don Abram, is really our project. You know Don? Yeah. Amazing guy who works not only for Interfaith America, but also leads an organization called Pride in the Pews. He is a rock star. It is my privilege. He would be here, except for I was just a little short drive down the road. But he is my inspiration. So I have a couple of QR codes that'll take you. The one on the left captures all the stories from what's happened over the last year, and the one on the right has information about applying for the grant. So capture that, share it with your networks. Dr. J is right. The best way to expand and deepen this work is through our networks, and each person in this room knows people who know people who know people. So please consider sharing this information. Again, there's contact information through the right-hand link that will take you to the chance to take folks who are interested to a chance to set up a conversation online, and we really thoroughly enjoy those conversations. So thank you for your time and for your attention and for all that you do.
Well, good afternoon, everyone. My name is Esther Ross Hines. I am enjoying this Faith Health Summit. This is the first time that I've been here, and I must say I've learned so much information that I am going to take back and to within my community. So I'm here to discuss a project that Wake Forest Faith Coordinating Centers funded, and it's called the Soul Project. Next. So I have this disclaimer. So the grant is supported by Wake Forest University School of Divinity Faith Coordinating Centers through Gilead Campus Initiative. But however, they have had no input in the development of the content or this material. And so I'm a person that's been a black woman living with HIV for 29 years. And it was so good to be in a discussion with Dr. Matthews when they talked about how HIV was looked at the beginning and how a person was wasting. I was 99 pounds. And, you know, if it, but God for the medications, I would not be where I'm at today. So I want to encourage you. It's so important to learn that because when we talk about healing, you know, our words matter. And I had a social worker that spoke life to me. She said, well, what you know about HIV, if you don't know anything about it, how are you going to fight it? You look like a fighter. Are you a fighter? And she dared me. And that's why I became a social worker. I got my BSW degree from East Carolina University and my master's in human service counseling at Liberty University. And I'm grateful for that foundation because, you know, I had to go through a lot of challenges to get to where I'm at. So now I'm comfortable where I'm at. I'm also 25 years, anyone out there in recovery, 25 years clean from heroin and crack. I must share that. A lot of people need, and I'm not, you know, I don't drink. I don't stop anybody else from drinking. It's just that I know I can't drink. And I keep that up front because a lot of times people don't know that there is, you can recover, you can heal from it. But if you don't know someone that is openly going to share, how they going to know? So I openly share my truth and what I believe. And I also, I'm 61 years old. Just celebrated a birthday. And I've been married to my husband for 22 years. So God is good. I shared with him when I was first diagnosed, and he embraced me, and I dared him to find out the information, and he did, and we've been together ever since. And he does not have HIV. I need to share that. So I am part of an organization called the Circle of Friends Task Force. It is formerly known as the North County AIDS Task Force, and because we're trying to get away from stigma, they changed the name to the Circle of Friends Task Force. But I just wanted to talk a little bit about this organization. This organization started in 1997. It became a nonprofit in around 1998, 1999. And it started out as an organization, people coming together from the faith community to help those that were dying from HIV and AIDS. They saw the devastation that people and the families went through, and they wanted to help in some kind of way, whether it be with their light bill, their rent, burial, insurance, medication. They did all these things, and they really started out that way. Since then, it has grown to now that we are helping people live longer with HIV. So we're not only dedicated or thinking about people as dying, but we want to help them thrive. Not only survive, but thrive. Next slide, because I'm not going to go through all of them. It's too much content. Okay, so there's several different programs that Circle Friends have been participated in. One is the Wellness Empowerment Team. We are advocates. They were advocates that went around across. We won Alicia Keys grant, and it was we were called the Women Empowerment Team. We Team of the East Girls on Fire. The men got jealous, so we couldn't call it Women Empowerment Team anymore. So now it's called Wellness Empowerment. So that's why the name changed. So it's a group of advocates that come together, and they go and just inform the community about the different concerns. One of the things was housing, that we have funds for people living with HIV for housing. For some reason, their formula was calculating people who were dead, which is more people living with HIV than dead. So that meant it was less money coming into North Carolina to provide housing. So they went to the Capitol, advocated to get that formula changed. So now it costs 33% more money to come into housing, to provide housing for people living with HIV. Also, we have another series that we have, Vision Inspired Purpose. It's another flip side to World AIDS Day. We wanted to honor people all across the state living with HIV who were, a lot of them have visions. They're inspired to do different things, whether it be art or whatever. We have that particular program that we do. And these are some of the other ones that we have. And all in all, we have about 25 years building in the community. And each one engages each other, like it's building. Now we are definitely, I don't know who here has heard of MIPA or JIPA, meaningful involvement of people with HIV and AIDS, and greater involvement of people with HIV and AIDS. And I'll get into that later on in a minute. So we are Faith Action Grant Partner. We thank you for the opportunity to really promote this new initiative called Soul Project. And Soul Project stands for Spiritual Opportunities Utilizing Leadership. And this is a faith initiative. It is where we have different leaders in the community. Because of the pandemic, a lot of stuff that were in person, we had to change it to virtual. And now we're just getting back to providing virtual and, in person. But because of that perspective, we wanted to provide information, especially as Ms. Henderson and Dr. J mentioned, collaboration is so important in partnership. We wanted to provide anyone in the faith leadership to be able to learn the different intersectionalities about HIV so that we can decrease stigma in our communities, because that is what's preventing people to access care, get the quality care that they need, and also thrive. You'll be surprised that people are still dying, and it's younger people that are dying from, and they don't need to. They or fear taking the medication, or anybody seeing them take their medication. I don't know if anybody was in when I was in the table out there. I took my medication. I pulled it out and I took it, because it should not be something that I should be fearful of. I'm doing what I need to do to take care of myself. And no one should be made to feel that way. And that's what we're trying to do, is really dispel that internal stigma and that external stigma. So we provide, and we call them faith champions. And we involve them into learning about historically marginalized populations. And I hate that terminology, but until I find another word for it, but I'm going to use it. And what we do is we're partnering with ending the HIV epidemic in North Carolina. This is a new initiative. Our goal is to educate about 45. We're at the halfway mark, 25. But it is a safe space for us also to talk about the gay, lesbian, gay, bisexual community, We have a lot of young people on our leadership roles that have gone on and taken become faith champions, and then go back out into their particular church or organization or other church, because a lot of times we invited to other people's churches, and when we go there we can share the information that we've learned. And also, who better to provide the resources that is so dwindling as far as the state perspective, but is not so much so in the faith leaders' perspective. So we must learn to engage them so that a lot of these things that people living with HIV experience, they'll be able to utilize so that they can better take care of themselves. And I need to share that taking care of yourself is risk reduction. Because when you take care, a person is taking care of themselves with HIV, they are less likely to pass that virus in the community. So it's everybody's participation is necessary if we're going to end HIV in this, especially among our Black African American, Black gay, bisexual men who have sex with men. So we offer 4 different trainings, and we felt that these were something that was needed. We did a brief assessment with some of the community members. We incorporate people living with HIV who are another program we have called LAMPS, Leaders Advocating, Mentoring, Personal Growth and Support. And they have went on to lead in other areas, and we did an impromptu assessment with them to find out what areas would a person need to really dispel stigma, how to address stigma, what is the internal and the internal impacts of stigma. So they felt that these different topics, these 4 different topics was needed. So the first one is Matters of the Heart, where we give brief important information and facts about HIV, the same, similar to what Dr. Matthews did. Also, our HIV civil rights, JIPA, MIPA, stigma and discrimination. We need to know how that impacts. And also how when you don't live in stigma, how that impacts good quality health. Also, the intersectionality and HIV spirituality is another area. And then it's surprising, but many people don't know that we have a North Carolina ending the HIV epidemic plan. You know, a lot of our churches don't know about that. And what we do is inform that to them, and so that they can become partners in this movement. And then we provide another training where they learn about how to provide trauma informed spaces and cultural responsiveness. You know, we come from different cultures. Cultural humility is okay, but responsiveness is when I'm showing that I'm accepting you at the table. It's not just, I'm accepting you, but just I'm embracing you, and I'm responding to your culture in a way that is engaging and less stigmatizing. So these are some of the areas, because I got the 1 minute sign, so I got to stop, because I get so passionate about this. But these are some of the things that we are doing. It's real important. If I was to leave anything with anyone, it would be that we need you. And I work with a lot of people that's 50 and over and think that their life is over with. It is not. We can, the engagement piece, young, old, this disease impacts both of us, whether young or old, and we need to make sure that we incorporate that partnership where both of them can come at the table and we can break bread, and then we can really get down to really ending HIV epidemic in North Carolina. Thank you.
Thank you to all our speakers. Does anybody have any questions?
And we get ready to do a Facebook Live forum called What's Going On, People? With Marvin Gaye. That's going to be part of the Soul Project initiative, where we're going to invite people to come and ask questions about HIV or anything good that's going on in the community. What are they doing to address stigma? And it's not only stigma with HIV, it's also with other health conditions as well. Mental health is a big one. Cancer is another one. But we're going to have it on different health topics as well. I don't know if you're going to share the information, our contact information with everybody.
I can do that.
Okay. Okay.
Do you mind if I steal that? What's going on?
What's going on, people? And one of our lamps,
Did she say yes, you mind?
no, I don't mind. I don't mind. We do the Marvin Gaye theme and all that kind of stuff. Yeah. It's a way to get people talking. Because I think the more conversation we have about HIV, the more we normalize it. Yeah, we normalize the interactions and stuff. Yeah. But if anyone is interested in, you get a faith champion certificate, and you learn about, and it's all available. The training is available online, so you could do it at your own pace. And it's really, the information is so impactful that you never know how these things intersect with one another until you look at the historical impact from the past and the historical impact from right now.
I have another question. Do y'all get involved with school systems? The school systems may not allow y'all in, but do y'all get involved with them? Because I've seen more of an impact of hitting them before they get into college. Because that's when they really go wild once they get into college. So you can get them even a little bit before then while they're in high school.
I know, and so in our area, I'm also the chair of what's called the Cumberland County HIV Task Force in our area. And so our direct door into the school is directly through the public health department, our health department in Cumberland County. And we also use Planned Parenthood. They're part of our chair. And so they both host like, Lord, and I'm gonna mess up the name of these classes because I don't know them all by heart. But they do like adolescent classes, they do abstinence classes for schools. And the wonderful thing about most places is that most churches don't even know that your local health department will literally come out in the evening to your Bible study and hit your youth at your Bible study too. And the wonderful thing about North Carolina is that we do have an abstinence program. So if your church is not okay, because I know every church is different, right? So every church is not okay with the condom conversation. So if your church is more the type of church that wants the abstinence conversation, you just express that to your health departments, and that's how we literally get our foot into the doors. They do classes. So I know the health department themselves do actual classes with the schools during the day, and then they host evening things, and Planned Parenthood as well hosts things on the evening. Now, Planned Parenthood can be a tricky one because some churches are like, no, we don't, but use the resources that you have. But absolutely, that is the way that we hit a lot of our youth that way.
Thank y'all so much for coming and engaging with us, and we really
Yes.
appreciate it.